There are so many causes of hypercortisolism. Among that, the exogenous cause is the most prominent one. So here now we are going to talk about the rest of the causes as well. As I told you, the first one and the most common one is the iatrogenic Cushing syndrome. Now, iatrogenic Cushing syndrome means that the exact cause, you can say that the exact cause is unknown, but in most of the cases, it is the exogenous source that the patient is taking, and it is causing an increase in the level of the cortisol hormone. Like the patient, as I told you, that the patient is using the steroids or any other glucocorticoid for the treatment of any other disease, like for any immune system disease, for any inflammatory condition, patient may take the steroid that lead to the Cushing syndrome because the level of the hormone is increased. This increased level will cause the adrenal atrophy. That is the most important characteristic of the pathology of hypercortisolism. So the cells will undergo atrophy and hypertrophy because of this iatrogenic causes, and it is the most prevailing cause in Cushing syndrome. Then the next cause that can lead to the Cushing syndrome or hypercortisolism is the pituitary Cushing syndrome. Now, pituitary Cushing syndrome means that the cause behind the hypercortisolism is lying here in the pituitary. Now, what can be the reason or how it is linked with the adrenal gland? Basically, you know that pituitary gland is signaling the rest of the glands inside the body by releasing certain hormones. Here, in context of the cortisol, ACTH is released from the pituitary. Now, this ACTH that is released from the pituitary, it acts on the adrenal gland and it causes it to release the cortisol. Now, whenever there is any pituitary disease, more specifically, you can say that whenever there is a tumor in the pituitary, what will happen that it will lead to hyperplasia. The cells will be hyperplastic. That will cause oversecretion of the ACTH hormone. When there will be the more secretion of ACTH hormone, this will really lead to the oversecretion of the cortisol as well. The more ACTH will bind to the receptors, more cortisol will be released. Now, because of this tumor, the pituitary cells are already in the hyperplastic condition. They will cause the adrenal hyperplasia too, because the cells are overburdened. They are working in hyperplastic condition beyond their limit. That will tend, because of which they will tend to increase their size and will lead to the hyperplasia. The next reason that can cause the Cushing syndrome or hypercortisolism is the adrenal Cushing syndrome. Now, we said that there can be any tumor in the pituitary that lead to oversecretion of the ACTH and then oversecretion of the cortisol. There can be a situation where there is the tumor in the adrenal gland. Now, this situation is same, just the location of the tumor is different. When the tumor was in the pituitary, it was causing the hyperplasia there, oversecretion of the hormone. Now the tumor is inside the cortisol in the adrenal cortex. So what will it do? It will cause the this number of the cell will increase and the release of the hormone will increase, and the rest part of the cell will undergo the hyperplasia that will lead to the increased level of the cortisol in the body and Cushing syndrome. Now, the next reason that can lead to Cushing syndrome is the paraneoplastic Cushing syndrome. Now, what is the paraneoplastic Cushing syndrome? We are talking about the tumors, that tumors can be the cause of Cushing syndrome. The first most prominent cause is the iatrogenic cause, that is the exogenous source. The second common cause is the tumors. The tumors in the pituitary gland, the tumors in the adrenal cortex, and now the tumors in the parts of the body other than pituitary and the adrenal gland. Here in this paraneoplastic Cushing syndrome, you can take the example of the lungs tumor. if there is any nodule in the lung, there is any tumor or the cancer present there, it can affect the ACTH level and it can lead to the adrenal hyperplasia, just like it was in the case of the pituitary tumor. So this will also increase the level of the cortisol inside the body and lead to the hypercortisolism. So what are the four main reasons? The iatrogenic cause, the adrenal tumor, pituitary tumor, and the paraneoplastic conditions that can also lead to the Cushing syndrome.